Sleep apnea is a very serious disorder that affects more than 12 million Americans. And this morning, Dr. Craig Schwimmer with the Snoring Center is here to talk about the diagnosis and treatment of obstructive sleep apnea. Craig, how are you?
Great, Amy. How are you?
Good. We're just talking about this, and I say, how many people come up to me and talk after your segments about their snoring habits and how that's keeping them awake? And 12 million Americans a year with sleep apnea, this is a big problem.
It's a big problem, and one thing that's been really frustrating is that we know over the past 10 years there's been such an increase in awareness as to how prevalent sleep apnea is. Some estimates say that 10% of adult males have sleep apnea.
Wow.
And yet the vast majority aren't even diagnosed, let alone treated.
Okay, well, remind us exactly what sleep apnea is.
Sleep apnea is a serious medical condition, and it's characterized by loud snoring and stopped breathing spells.
Okay.
So a typical patient with sleep apnea comes in and tells the story of, my wife says I snore, she's worried that I stop breathing. And doc, you know, I get 7 or 8 or 9 hours of sleep a night, but I wake up in the morning and I feel worse than I did when I went to bed. I'm tired during the day, and that's a classic history for somebody with sleep apnea.
Okay, so why is it so dangerous to us?
Well, it's dangerous because those stopped breathing spells put a big stress on our heart and our lungs, and so people with sleep apnea have an increased risk of high blood pressure, stroke, heart attack, and also because those stopped breathing spells interrupt the normal sleep cycle, those patients are tired. And we've talked about the dangers of sleepy drivers. People with sleep apnea have a 6 times increased risk of automobile accidents compared to people who get normal sleep. They're more likely to suffer from workplace accidents.
So this is leading to bigger problems.
Absolutely.
The sleep apnea is that's just the start of it.
Sleep apnea is associated with a whole host of really serious medical problems.
And it doesn't just affect men. I know you said about 10% of men might suffer from sleep apnea, but women certainly are
Absolutely,
too.
about 4% of adult women.
Okay, and things are changing in the way that we can treat sleep apnea.
Things are changing. You know, diagnosing and treating sleep apnea has always been very frustrating for both the patients and the doctors. There's been impediments really at every step of the way. Traditionally what would happen is the patient would come into a doctor's office and say, Doc, I snore, my wife says I stop breathing, I feel terrible in the morning, I'm tired during the day, and the light bulb goes off in the doctor's head and says, oh, you've got sleep apnea. But instead of telling that to the patient, what the doctor would have to do is say, okay, you need to go and spend a night at a sleep lab and get hooked up to 20 different machines, and they'll study you overnight, and then they'll send me a report, and that'll tell me that you have sleep apnea. And that's not only, well, it's
time-consuming.
It's time-consuming, it's inconvenient, it's very expensive.
I was going to say, how much does that cost?
Several $1,000s.
Yes.
And a lot of patients don't have the time. It would dissuade many patients from going through with that, and so they never get diagnosed, so they never get treated.
Okay, but Medicare has changed things, which is the good news.
Thankfully, there's been some good news. Just in December, Medicare has changed the rules, and they will now allow doctors to send patients home with home-based sleep studies. So instead of having to go to a sleep lab and get an inconvenient and very expensive test, many patients can now simply take a little device home and get a $300 test that they perform in their own bed, bring it back to the doctor, and then you get your diagnosis.
Which is motivation to anyone who is suffering to actually go to step 2 and get diagnosed. And now that they have sleep apnea, the good news is there's so many treatments that are less invasive and they work.
Absolutely. Well, the battle that I fight every day, of course, is getting acceptance for these more patient-friendly treatments. Again, you know, it's always, okay, you've got sleep apnea, wear this device that most people can't, or have this surgery that's very invasive that most people don't want. But for many patients, there are more patient-friendly, minimally invasive options now, which is the good news.
Which is very good news. And the pillar procedure, which you do so many of these procedures every year, you reap the benefits of seeing all these people getting good night's sleeps. Explain again what the pillar procedure is and how great it is.
You know, to me, the pillar procedure has just been a life-changing innovation. It is not perfect, but for so many people, the combination of minimal invasiveness and high efficacy really makes it possible for them to get a treatment they can live with. I see patients every day who have been told, okay, you need to wear CPAP, you need to wear this machine, and they come and they say, Doc, I've had the machine for 2 years, I can't wear it. And I know I don't want the surgery, and so I've been untreated for 2 years. Well, okay, you know what the good news is that now there's a 15-minute procedure that has a very high likelihood of giving you significant improvement. And so for those people, I say, you know, there's hope. There are new treatments that are available. So
even if maybe you visited a doctor a couple of years ago, revisit the issue because times are changing and there's some good news in treatment and you can get a better night's sleep. Craig, thank you so much for being here. All right, the Snoring Center has locations in Dallas and Fort Worth. Log on to snoringcenter.com for more information on both offices. Up next,